Welcome to the Depression and Healthy Living module for trainers. We've designed this as a companion to your trainer's guide to help you visualize the recommended steps for sharing information about managing depression effectively. As a trainer, your goal is that by the end of the session, participants will be able to define depression and describe its impact, list symptoms and risk factors for depression, list ways to reduce risks of depression, list the obstacles to seeking care for depression, name treatment options, list questions to ask when seeking care, and prepare an action plan. Here's a quick overview of the flow of a complete depression and healthy living session. The introduction should take about 10 minutes. A discussion about the definition, symptoms, and impact of depression should also take about 10 minutes. A discussion about the risk factors for depression should take 10 minutes. A group activity for which activity cards are provided will take about 15 minutes, followed by a second 15-minute group activity on overcoming obstacles to seeking care for depression. A discussion about options for treating depression will take 10 minutes, and a discussion about what to ask when seeking care will take another 10 minutes. Allow 5 minutes for going over the action plan, and closing the session should take about 5 minutes. You may decide to omit these 3 topics if you're conducting a 60-minute version of the session. Now that you've seen the big picture, let's talk about the materials you'll want on hand before your participants arrive. Here's a checklist of materials that will help the session go smoothly. Check that you have a flip chart, markers, name cards, and optionally, refreshments. There are 5 handouts for this session: Depression, What You Need to Know, What to Do if you or someone you know is suicidal, Tips to Reduce the Risks of Depression, Tips to Overcome the Obstacles to Seeking Care, and a Depression Action Plan. Print out enough copies for all of your participants before the session begins. There are also 4 activity cards, 2 for Activity D and 2 for Activity E. You'll only need to print 1 copy of each card, and you can find the originals in the printable materials section of your trainer's guide. Lastly, prepare an attendance sheet so your participants can sign in when they arrive. With your materials in order, you can begin introducing the session. Topic A of the trainer's guide covers everything you'll need for getting the session started. As the participants enter the room, greet them warmly to create a welcoming atmosphere. Ask each person to sign the attendance sheet. Write each participant's name on a name card and make sure the card can be seen. After all participants are seated, introduce yourself formally to the group. Ask participants to introduce themselves and provide a simple guideline about what information they should share. For example, you might ask that they state their name, their hometown, and a favorite hobby. After the introductions, explain that the session will last 60 minutes or 90 minutes, depending on the time you've allowed, and tell the participants what they can expect. You can state that there will be group discussions about depression, activities for learning about reducing the risk of developing depression, opportunities to think about and share ideas about depression, and printed handouts with information covered during the session. Make a special point to encourage participants to ask questions at any time during the session. Remember to mention where the restrooms and water fountains are, especially if there are participants who are unfamiliar with the location. Before you begin the actual content of the session, ask the participants for suggestions about setting some ground rules for the next hour or 90 minutes, and write their suggestions on the flip chart. Keep the rules visible someplace in the room throughout the session. Your group is likely to come up with their own ideas, but typically it's good to include turning off cell phones, keeping all discussions during the session confidential, feeling free to ask questions, and avoiding sidebars by directing all questions to you or to the entire group so that everyone can hear the discussion. The first topic is depression. Definition, symptoms, and its impact. This will be a group discussion, and you can start it off by asking participants, what is depression? Who is at risk to develop depression? And Why is it important to seek treatment for depression? Use a new sheet on the flip chart to write their responses. The tips section for Topic B in the Trainer's Guide lists some additional questions you can ask to get the discussion started in case the participants don't begin participating right away. As you summarize the participants' responses, supplement what they say by using the information in the key points boxes for Discussion B in the Trainer's Guide. Avoid reading the content word for word so that you can maintain eye contact with the participants. The key points define depression as a serious medical illness, just as diabetes and high blood pressure are medical illnesses that significantly impairs your thoughts, feelings, and ability to function in daily life. It is not just in your head, a character flaw, or a sign of personal weakness. Everyone occasionally feels sad, but these feelings usually go away in a few days. The key points explain how this is different from depression by listing its symptoms, which can be different from person to person. For example, symptoms of depression can start very suddenly or come on gradually over time. Symptoms of depression include feeling persistently sad, anxious, or empty, as if there's no meaningful purpose in life, feeling hopeless or pessimistic, feeling guilty, worthless, or helpless, irritability or frustration, especially over small matters, loss of interest in normal activities or hobbies, fatigue, indecisiveness, difficulty concentrating, remembering details and making decisions, being unable to sleep, waking up early or sleeping too much, a significant change in appetite or weight, recurrent thoughts of death, suicide, or attempted suicide, aches or pains, headaches, cramps or digestive problems, and crying spells for no apparent reason. Not everyone who is depressed experiences every symptom, and there are different forms of depression. The forms include major depressive disorder, bipolar disorder, seasonal affective disorder, and postpartum disorder. Major depressive disorder is diagnosed when the symptoms are disabling and prevent a person from functioning normally. A person with major depressive disorder has 5 or more symptoms of depression every day for at least 2 weeks, and one symptom must be either depressed mood or loss of interest in normal activities. To answer the question, who is at risk to develop depression, the key points explain that depression is a common illness and people of all races, cultures, and ages can be affected by it. To answer the question about why it's important to seek treatment for depression, the key points explain that even the most severe cases of depression can be treated. Depression is the leading cause of disability in the world. Depression can also be deadly. While everyone's different and it may take time to find the right treatment, it's very important to seek treatment. Thank everyone for their participation and conclude the discussion by emphasizing that depression is a serious medical illness that can have severe consequences if it isn't treated. Distribute the handout titled What to Do If You or Someone You Know is Suicidal, and then continue with the next topic. Unless you're running a 60-minute session, in which case you can omit this topic and go directly to Topic D, the next topic is a discussion on risk factors for depression. Begin the group discussion by asking participants what factors increase the risk for depression and which of these factors are under your control. Summarize the participants' responses and use the information in the Key Points for Discussion C section of the Trainer's Guide to make sure all important points have been covered. As before, avoid reading the points word for word so that you can maintain eye contact with the participants. If you're asked what is meant by a risk factor, you can explain that it's a situation associated with an increased chance for something to happen. For example, being overweight is a risk that may increase a person's chance of developing a condition like type 2 diabetes. As shown in the key points, risk factors for depression that people can't control are being female, having biological relatives who have depression, stressful life events, severe or chronic illness, and traumatic experiences as a child. Explain that there are several risk factors for depression that are under our control. Abuse of alcohol, nicotine, or drugs can reduce the effectiveness of treatment, prolong depression, and increase the risk of side effects. A second risk factor is being physically inactive. Physical activity can reduce the chance of developing depression, especially for elderly persons. A third risk factor is not having friends or supportive relationships, because being isolated can make problems worse. Healthy relationships and a strong social network can provide support that reduces the risks. Another risk is having certain personality traits, including chronic worrying, being compulsive, having goals that can't be reached, or being extremely self-critical. A final risk factor for depression that can be controlled is taking certain medications. Remind participants to talk with their doctor before stopping any medication they think may be affecting their mood. Conclude the discussion by thanking everyone for their participation and emphasizing that many of the risks of depression are under our control. The first group activity is Topic D in the Trainer's Guide, and its purpose is to guide participants toward understanding the difference between controllable and non-controllable risk factors for depression, and to provide strategies to reduce the risk of depression. You'll need your markers, the flip chart, and one copy of both of the activity cards, each of which has a different scenario about a person at risk for depression. Explain to the participants that during this activity, they'll learn about ways to reduce risks for depression. You'll find sample instructions for introducing this activity in the Trainer's Guide. You'll use your own words, but you can begin with something like, to begin the discussion about the risk factors for depression, we're going to conduct an activity. After you've introduced the activity, divide the group into 2 teams. Give each team an activity card. Give them 5 minutes to read the scenario on their card and discuss answers to the question at the bottom of the card. Let them know that they'll be asked to select one team member to present their team's answers to the entire group. Let the teams know when there are about 2 minutes left so they can start finishing up. When the 5 minutes are over, ask the selected member from each team to share the information on their card and the answers they come up with for their question. After each team finishes their report, your job is to clarify or provide additional information. There are key points boxes for this activity in the Trainer's Guide that include all the information that should be covered before the end of the activity. The key points apply to both scenarios in the 2 activity cards, but some suggestions may be more relevant to one scenario than the other. All of the suggestions can help lower the risks of depression. The first set of suggestions are about the importance of supportive and healthy relationships. One suggestion to lower the risks of depression is to talk with a relative or friend that you trust. Another is to confide in a counselor, therapist, or member of the clergy. Be around positive people and participate in social activities you enjoy. A final suggestion in the area of supportive and healthy relationships is to get together with family and trusted friends regularly. The second set of suggestions that could be used to help both individuals described on the activity cards relates to setting realistic goals that aren't overwhelming. The theme is to try to focus on what you're able to do instead of what you can't do. Share with participants the idea of simplifying your life by not taking on too many obligations. Make a daily list of a few things you want to complete that day and stay focused. Split big or complex tasks into small steps that are achievable. And lastly in this category, postpone making important decisions when you feel down. The third set of suggestions applies to the people in both scenarios. It's about maintaining good overall health. Exercise regularly. Eat a healthy diet. Get plenty of sleep and establish a regular sleep pattern. Maintain personal grooming. Practice relaxation techniques and expose yourself to a little sunlight or a light box every day. Emphasize that all of these suggestions can help people reduce their risk of depression. To conclude the activity, thank everyone for their participation and distribute the handout titled Tips to Reduce the Risk of Depression. The second group activity guides participants toward understanding the obstacles that prevent people from seeking care for depression and provides strategies to overcome the obstacles. The format of this activity is very similar to the prior activity. You'll need markers in the flip chart and one copy of each of the 2 activity cards. Begin by explaining that during this activity, they'll learn about strategies to overcome obstacles that prevent some people from seeking care for depression. The sample instructions for Activity E in the Trainer's Guide provide an introduction that you can put into your own words. As in the previous activity, you can begin by explaining that during this activity, you'll again divide the group into 2 teams and give each team an activity card. Each card has a list of obstacles that prevent people from seeking care for depression. The lists have several items in common so that the group will have an opportunity to come up with a variety of ideas. Give them 5 minutes to read the list of obstacles on their card and discuss answers to the question at the bottom of the card. Let them know that they'll be asked to select one team member to present their team's answers to the entire group. Let the teams know when there are about 2 minutes left so they can start finishing up. When the 5 minutes are over, ask the selected member from each team to share their suggestions for how to overcome each obstacle. After each team finishes their report, supplement what the teams have shared with the information in Key Points for Discussion E in the Trainer's Guide. You'll find strategies for overcoming each obstacle on the activity cards. A strategy for the obstacle of not thinking you're depressed is to find out if you have depression or whether your symptoms are caused by another condition that is not being adequately treated. For lack of motivation, a strategy is to make a list of questions to ask when you see a healthcare provider about depression. For the obstacle of doubting whether treatments work, a strategy is to find accurate information about the effectiveness of treatments for depression from reputable sources. For the obstacle of fear of the side effects for medications, a strategy is to make a list of questions to ask about the side effects that are most important to you and to ask them when you see a healthcare provider. If fear of revealing personal problems is an obstacle, a strategy is to remember that there are laws that healthcare providers must follow to keep your information private. You can also use online resources. If stigma is an obstacle, it can be helpful to know that this is a common reaction. However, depression labels are untrue. Depression is a medical condition that can be treated. If the obstacle is doubts about the capabilities, knowledge, skills, and understanding of healthcare professionals, find a healthcare provider who specializes in treating people experiencing depression. For fear of being institutionalized, one strategy is to remember that hospital or residential treatment programs are only considered if there is a significant risk to self or others. Finally, if treatment cost is an obstacle, it can be helpful to check with local social service agencies and your healthcare provider. To conclude the activity, thank everyone for their participation and distribute the handout titled Tips to Overcome the Obstacles to Seeking Care for Depression. Unless you're running a 60-minute session, in which case you would skip directly to topic H, the next topic is a group discussion about options for treating depression. Begin by asking the group, what are the different ways to treat depression, and how effective are these treatments? Write their ideas on the flip chart and use the key points in the Trainer's Guide to clarify and supplement their thoughts. Share with the participants the idea that even the most severe depression can be treated. The earlier treatment begins, the more effective it is. The first step is to visit a doctor or mental health specialist. If the physician can't find a medical condition that may be causing the depression, the next step is psychological counseling. The key points explain several ways that depression can be treated. One form of treatment is psychotherapy, sometimes called talk therapy. A licensed mental health professional helps people with depression focus on behaviors, emotions, and thought patterns that contribute to depression. They also help the depressed person identify and understand life problems that contribute to their illness so they can regain a sense of control. Cognitive behavioral therapy is the most commonly used form of psychotherapy for depression, but there are many other types. Share with a participant that it's important to talk with their doctor or healthcare professional to decide which treatment option is best for them. You can explain that the American Psychiatric Association treatment guideline supports the approach of using psychotherapy for persons with mild to moderate depression. But the association also notes that a combination of psychotherapy and antidepressant medications may be more appropriate for individuals with moderate to severe depressive disorder. A second form of treatment for depression is medication. Antidepressant medications are commonly used to treat depression and primarily work on chemical messengers in the brain that help regulate mood. The three primary messengers involved with depression are serotonin, dopamine, and norepinephrine. When the levels of these messengers are low or not properly balanced, depression may occur. A family doctor can prescribe medications for depression or provide a referral to a psychiatrist. Everyone is different, and finding the right medication or treatment combination will likely take some trial and error. Alternative treatments are a third form of treatment for depression. Alternative treatments can sometimes provide relief that traditional Western medicine cannot. Examples include acupuncture, guided imagery, chiropractic treatments, yoga, hypnosis, biofeedback, aromatherapy, relaxation, herbal remedies, massage, music therapy, dance movement therapy, and many others. A fourth form of treatment for depression is electroconvulsive, or ECT therapy. An electric current is used to produce a seizure in the patient. It is believed that ECT results in the release of chemicals in the brain that aid communication between nerves. It's used for severe forms of depression, particularly when antidepressant medications have not worked and when there is a high risk of suicide. Conclude the discussion by thanking everyone for their participation and reminding them that many forms of treatment for depression are available. Unless you're running a 60-minute session, in which case you would omit this topic, the next topic is a discussion about what people can ask when they're seeking care for depression. Begin by asking two questions. After someone decides to seek care for depression, what should one do to prepare for the appointment? And, when meeting with a healthcare provider, what questions should a person ask? Write their responses on the flip chart. You can use the material in the Key Points for Discussion G to supplement their answers. Here's a brief summary of the information a person should be prepared to provide. As much information as possible about how you're feeling. A description of your depressed feelings and how they affect your life. Any decreased interest in doing things, any family history of depression, any medications you're taking, what things are important to you, and whether you have any thoughts of suicide. The key points have more information about each of these items. The key points also include questions that the person seeking care should be prepared to ask the healthcare professional. What is your experience in diagnosing and treating depression? How can I be sure that the information I provide will stay confidential? How will you know that I'm depressed enough to justify treatment? What tests will you do? What treatment is likely to work best for me? What are other options for treatment? If you prescribe a medication, how long will it take for the medication to work? What are the likely side effects of medications or treatments that you would suggest for me? What can I do if I'm concerned about the cost? Will you give me some written information about the treatments we discussed that I can take with me? Conclude the discussion by thanking everyone for participating. The next topic addresses the importance of having an action plan and its item H in the trainer's guide. Distribute an action plan to each participant, then ask each person to review the items on the plan and select one or more items that they'll try to change or improve. The choices on the action plan include: get the facts about depression, get information about treatment options from your healthcare provider, continue with the prescribed therapy, maintain and build healthy relationships, take care of yourself and stay physically active, and simplify your life. The key points about the action plan in the trainer's guide recommend that you emphasize the importance of an action plan and how it relates to improving and maintaining a healthy life. Share with participants that lifestyle changes are made one step at a time. Therefore, they should be ready, willing, and able to make changes that will improve their chances for a better and healthier life. Explain that there are 4 questions you would like them to ask themselves based on what they selected on their action plan. They are: what behavior would I like to change? Is it a behavior that I can do? What must I do to achieve this change? And when will I make this change? Ask participants to select their confidence level for the behavior they have chosen to change. Ask them to select a number on a scale from 1 to 10, with 10 being the highest, indicating how confident they feel about completing their action plan. If a participant's confidence level is less than 7, ask him or her to consider an easier plan. Conclude the session by distributing and explaining the Depression What You Need to Know handout. Invite the group to ask questions about the handout. Remember to thank the participants for their attendance and participation. Finally, invite them to return to the next session and encourage them to bring a family member or friend. Thank you for your contribution in sharing this important information, and thank you for participating in this training.